Morning, sir.
Good morning.
I reminded Madam, I think
Yeah, she has already come.
she's. Okay, thanks.
Good morning, sir. Good evening, sir.
Good
Badri,
evening.
sir.
Good evening.
You are abroad, sir?
Yeah, I'm at US.
Oh, then we can have our meeting in Zoom also, sir.
Yeah,
The
yeah,
main
yeah,
idea
yeah.
is to demonstrate exercises. I thought offline will be better.
Yeah.
We can talk about that or other things if you want Zoom.
Yeah. We'll discuss and finalize
Yes, sir.
at
Yes,
your
yes,
convenience. The
yes, sir.
speaker has joined. We'll wait for another 5 minutes and then we'll
Yes, sir.
start. Is it okay?
Fine, sir.
Yeah. मम्मी की लॉगिन பண்ணிடு मम्मी I'm happy to note that Dr. Hemal had already joined. She's there. I have made it her as a host so that she'll be able to make some presentations and all those things. Good evening, Hemal, madam. Good evening.
Good evening, sir. Good
Nice
evening.
to see you.
Good evening, Dr. Amal. I'm Pranay's secretary.
Uh-huh.
It's nice that you accepted our invitation at a very, very short notice. And it is nice.
Actually, I already have a very big expert with you.
Oh, in fact, ma'am, for your information, we are recording this, and thereafter
Okay.
we'll convert into a YouTube and then share with all the people, because
Okay.
people, for some reason or the other, they may not be able to join for some personal reasons, etc., etc. So, though the attendance may fall short of expectation, but still, we will go ahead. We'll wait for another 2-3 minutes. Is it okay?
Sure.
Yeah. Only thing is, if they are present in the Zoom meeting, they can ask some clarifications. But if we are going to watch the YouTube, it's going to be that they will only hear what the questions are asked and what is the answers given. They lose that opportunity to ask the questions. Anyway, after the posting the YouTube, we will ask the participants if they have got any questions, and we will consolidate and share it with you. We will make it as a small note and send it to you so that you could leisurely look into it and give your clarification, which again we'll share with all the participants. Is it
Sure.
okay? Is it okay?
Yeah, it's okay. It's okay.
So it is Oh, Kaza ji, namaskar. Namaskar, Kaza ji. Namaskar. Please, please unmute and speak. Please unmute and speak. After the speaker speaks, we will give opportunity for you to ask questions. Then please unmute and ask the questions. Thank you. Hemalji, I think we should start.
Okay, sure.
People will join during the course.
Sure.
Because we always have a habit of joining late. Many people. I don't mean you and me. Many people. Anyway, I'll just say a few words about organ donation, of course,
Yes, sir.
which we have taken down from your website. This is for the
Sure.
information of the. Of course, you will deal with it in more detail. Organ donation is one of the most selfless acts a person can perform, offering chance and life to those suffering from critical organ failure. It involves giving an organ or tissue, either during one's lifetime or after death, to someone in need of transplant. Vital organs like heart, kidneys, liver, lungs, and pancreas, as well as tissues such as cornea, skin, and bone marrow, can be donated. The need for organ transplants far exceeds the availability. With thousands of patients waiting to hope every day by pledging to be an organ donor, one can save or dramatically improve multiple lives. Organ donation is regulated to ensure ethical practices, consent, and safe medical procedures. Awareness and dispelling the myths are essential to encourage more and more people to register as donors. For senior citizens, while some organs may not be suitable for donation, tissue like corneas and skin often remain viable. This is one of the questions many of the senior citizens may have. Age is not always a barrier. Medical suitability is determined at the time of donation. Organ donation is not just a medical act. It's an enduring legacy of compassion, humanity, hope. Choosing to donate is choosing to give life. It is in this context we have arranged this meeting. Before I introduce the speaker, I would like to welcome Dr. Hemal
Thank
for
you,
having
sir.
accepted the invitation at a very short notice and agreeing to our request. As it is customary, I would like to say a few words. Of course, she has got a long biodata, but I'll make it very short. Today's speaker is Dr. Hemal Kanminde. She is a doctorate. She started working in the field of organ donation since 2011. She has been faculty member of Transport Coordinators Training for teaching national and international transplant law. She has assisted in organizing and planning medical and nursing training, workshop on brain death, and deceased organ donation. She has a working and practical knowledge of social and gender issues. At present, she is the Quality Assurance Officer at Mohan Foundation, MOHAN Foundation, and is responsible for running a national helpline on organ donation. She is also responsible for public engagement to promote organ donation through training volunteers, ambassadors, life members, and interns. Her work on organ donation has been published and been presented at national and international conferences. She is the past trustee of Golden Butterflies, an NGO that works for children's palliative care in Chennai, and trustee CARES, CARESS, an NGO that works with local environment and livelihood. In short, her past experience are MSSRF 15 years as program leader, CARESS 4 years as trainer and content developer, and of course at Mohan Foundation for 13 long years. Her continuing in Mohan Foundation for 13 long years itself shows her commitment for the cause. It speaks. Generally, nowadays people skip their roles very frequently for their own reasons, but some people, they continue to work with zeal and enthusiasm within the organization to promote them. With this short introduction, I will leave the floor to Hemal. And before that, I request Hemal to permit me to a few words about
sir.
the 15th Indian Organ Donation Day ceremony held on 3rd August at New Delhi, where our Union Health Minister Sri Jagat Prakash Nadda addressed. It is there in the website, and it has been posted by Press Information Bureau on 2nd August 2025. And he says, India achieved a remarkable milestone of performing over 18,900 organ transplants in 2024, the highest ever recorded in a single year, a significant leap from fewer than 5,000 transplants, 5,000 in 2013. And he also says that India leads the world in hand transplants, showing our cutting edge surgical capabilities and unwavering dedication of our medical professional. And he also says India ranks third globally in the total number of organ transplants, behind only United States of America and China. With this few words, I would throw the floor open to Dr. Hemal. Kindly mute yourself after her presentation is over. We shall have a question answer session. We have adequate time. Don't worry. It is not a 45 minutes free Zoom. So no apprehensions. And please make use of this opportunity to hear her and try as best as possible to spread the awareness. Thank you. And Hemalji, the floor is yours.
Thank you so much. First of all, I'm really honored to be among such great people. Dr. Kanakasabai, I have known him as one of the pioneers, along with Dr. Devika and Dr. Ramalore. I have been to the medical college at multiple occasions when I was very young, and I used to admire their work a lot. And especially when they used to have this, the donor family felicitation and all, it really moved me. And then only then I started working for this cause. So thank you for, making me see him again after many, many years. I've seen him today. And so you should be leading the talk. And once in a while. And also Dr. Amalur, but today I'm seeing you after maybe 10 years or something. So it's really nice to see you at least. Thank you very much, all of you, for thinking of organ donation as a topic for discussion. The more we speak about it, the more we discuss about it, more it becomes a normal thing in our lives. And more people will come forward to pledge as well as to give consent in case of a sad happening in the house. So to start with it, Mohan Foundation has been serving in the field of organ donation for more than 28 years. We have now offices in multiple places in the country. Where we started 27 years ago, it was only in Chennai. So I'll just say in short the concepts of organ donation. This is what Mohan Foundation does. We do a lot of counseling, grief counseling. We do a lot of public awareness, and we do training. Training is of a couple of types. One is for nursing students, allied health students, and social work students to become grief counselors and transplant coordinators. This is a group of people who really have the difficult task of talking to families, grieving families, and understanding how to ask for organ donation in the time in the ICU, outside the ICU, on the corridors. So this is a special group of people who have great skill and patience to understand family dynamics and talk to families and get a yes. You should be really proud that Tamil Nadu has a lot of trained transplant coordinators with a success rate of more than 70%. So that is how our transplant coordinators and grief counselors work. Most of the time, they get a yes from a grieving family if a patient has become brain dead. So the gift of life, let us talk about it. It's a very silent tsunami. Nobody talks of organ failure in our country. The newspapers don't carry any news about the amount of people who are waiting for organs. As Mr. Badri has already quoted, the 3rd August thinks that there are many people waiting for donations, and there is a high rate of organ failure, especially kidney failure. And therefore, nobody talks of it. But nearly more than 2 lakh people, the number of people who passed away during the tsunami, that many people are waiting for organs. Even more than that, actually. But we do not speak about it. So that's why I put a picture of a tsunami, that this is a wave that we do not know about. Public doesn't know about. So I've got a picture of the donation rate in India. And the recent rate has even crossed 1,200 or something last year. I'll just tell you the figure. Slowly, we have been building up in India our capacity to convert into to become organ donors. Last year's rate was 1,128. So we have been consistently over past 2 years having more than 1,000 donors in our country, but our need is much more. Where we have a donation rate of 0.8 per million population, but to wipe out our waiting list, we need a donation rate of 3 per million. So that is a big step that we need to do. There are many ways to do it. The simplest way first is the organ donation awareness. There is a law under which we all work. It is called the Transplantation of Human Organs Act, 1994, and amended in 2011. The purpose of the act is to ensure that everything is above law. Commercial dealing does not happen. It also recognizes brain death as death. Therefore, doctors are able to certify patients as brain dead. It also regulates how hospitals will function, how eye banking system or the tissue banking system will function. It gives clear guidelines for living related and unrelated donations. This is in just the law about organ transplant. So organ donation is nothing but the process of removing one organ or a tissue from one person and giving it to others. Organ donation is only done for therapy. It is not done for any research. While tissue donation the donation can be used either for therapy or for research. Okay? A donor can be a living person or a deceased person. Now we come to deaths. All of you are very senior, would have thought about it. So there is circulatory death when the heart stops functioning and the circulation stops functioning, Under these circumstances, tissue donation is possible. Voluntary donation is body donation, whole body donation is possible, but family consent is essential for any activity after death. Okay? In tissues, you can donate cornea, skin, heart walls, bones. All this can be donated. Cornea donation and skin donation can happen at home. Chennai has 3 skin banks. So any of them can be called and they'll come and do the skin donation. And cornea donation, is a very simple process of removing just the cornea from the eyeball. And nobody comes to know that donation has happened. Even for skin donation, nobody comes to know skin donation has happened, in case the family does not wish to give publicity to that fact. Something called as brainstem death. This is a simple definition of brainstem death. You can see there are 3 types of pictures. One is a normal brain, which all of us are having right now. We can understand, we can hear, we can, we are breathing, our blood pressure is working. All this is a normal brain. All parts are functioning. But when the top portion, the cortex, is not functioning, a person is said to be in coma or a vegetative state. That case, the person is able to breathe on its own, okay? But the person cannot respond. The person, in case of brain death, the brain stem stops functioning, and then the whole brain also stops functioning. This is an irreversible condition. And this condition, when all areas of the brain get damaged, the patient cannot sustain life, and therefore the patient is defined to be a brain stem dead patient. According to the Act, there are 4 doctors who will certify brain stem death. And the tests are done twice. 2 of the doctors are from a government established panel. So there are lots of checks and balances that no illegal or unfortunate brainstem death is certified. What are the causes of a person to become a brainstem dead? The main cause is trauma, head injury, falling down, road traffic accident where there's a head injury, that type, tumor in the brain, no blood reaching the brain is called ischemia. When you have so much high blood pressure that sometimes the blood pressure does not allow the brain to receive blood, so that is called ischemia. And there is intracerebral hemorrhage where there is a leak in the brain and the blood vessel opens up and all the blood flows everywhere in the brain, and therefore the brain tissue does not get oxygen and nutrients, and so it starts to die. Are you understanding this?
Yes, yes, very clear.
Okay, okay, thank you so much. So now, in case a person has to be a donor, a living patient, a living person can donate 1 kidney, blood, bone marrow. Part of liver is very commonly done from a parent to a child. Part of pancreas and lungs is very rarely done in our country. Okay, this is when you are living, what is that you can donate. After circulatory death, as I said, tissue donation is possible, cornea donation, skin donation, and heart valves. Okay. Skin donation, I would like to say, is a very important part because it is an external bandage. It is a life-improving donation, not maybe even life-saving in many cases, because when a person maybe has an industrial accident and loses skin, or has a burn injury and loses skin, most of the time the patient passes away due to infection and dehydration. That can be stopped by putting skin on the wound. So the skin is like a natural bandage. It doesn't allow external bacteria and viruses to enter the patient's bloodstream and cause infection. So that is why skin donation is important. Skin donation is taken from the back and the back of the thighs. It's a 45-minute procedure. There is no blood or anything coming out from the body of the deceased, and nobody comes to know that donation has happened. Okay? But a patient becomes brain dead, it is possible to donate multiple organs, because in that stage, when the brainstem has stopped functioning, patient is not able to breathe on his own. So the patient is put on a ventilator. Because of the ventilation, the heart continues to beat and there is circulation, and therefore the organs are still functioning. And so multiple organ donation is possible when a patient is brainstem dead. So how soon should the donation happen? The donation of all organs, there is a time limit. It is called as warm ischemic time. That is when the organ is outside the body. In that case, within 6 hours, skin donation, eye donation, heart and lung donation should happen. That is, from the patient donor to the recipient, within 6 hours, the heart and lung should reach. Liver, pancreas and kidneys can be kept outside the body in special liquids for a little more time, and they will still continue to function in the recipient's body. But heart and lung is a very crucial time, and therefore sometimes you see something called as a green corridor, where all the lights in the traffic are made green so that the ambulance can go fast. You may have read it somewhere, or you would have watched a movie, something. saying such things. And the reason is this, that within 6 hours of removal of the organ from the donor body, it has to reach into the recipient's body within 6 hours. A little bit of voluntary body donation. You may have had family members who have become body donors. It is the act of donating one's body for medical studies. The body is taken to only government medical colleges because they have the license to receive. Not all private medical colleges have the license to receive. However, in Chennai, SRMC Porur has the license to receive a voluntary body donation. Anyone can become a body donor. Registration is a necessity, but not a compulsory thing. But if you have pre-registered to become a body donor, it is easy for the hospital and the medical college to receive the body. The donation should happen within 6 hours of death. The body is accepted in the anatomy department of the medical college, and it is given full reverence when it is accepted. That's all about voluntary body donation. Skin donation, I spoke about how skin should be donated within 6 hours of death. So some myths, because whenever we are talking to the public, there are some myths in people's mind. My religion may forbid me to donate. So all major religions actually support helping others. We are always being told that whoever is unfortunate, you should help them. And after we are gone, there is nothing greater than giving life to others. Myth: organ donation mutilates the body. This is also a common concern among the public. Donated organs are removed by very, very fine surgeons. And also the donor body is packed and clothed, and only then it is given to the family members back. The process of organ donation after the family has given consent may range from 12 to 24 to 36 hours also. So the family will have to wait for that much time to receive the body back. So if the family agrees to donation, the family agrees to, doctor will not save the patient. This is not happens. Whenever there is a neuro injury, the doctor taking care is in the neuro ICU. He has nothing to do with the transplants. No doctor will not try to save a patient. That is something that has come up recently. Where does the patient go in times of trauma? It goes to the trauma or the casualty or the emergency. Those doctors have nothing to do with the transplant. They are not a nephrologist. They are not a transplant surgeon. Nobody is there in the trauma ward. So the doctors will always try to save a patient's life when they come initially to the hospital. Donor family will have to pay more money to the hospital. Once brain death is declared, suppose a patient comes in the hospital with head injury, and after 4-5 days, the brainstem death stops functioning. After declaration of brainstem death by the 4 special doctors and the family giving consent to donation, after that, there is no bill to the family members. No hospital charges any bill to the family member once consent is given. There are expensive towards the OT and towards the retrieval charges and all that, but that is not put on the family's shoulders. A little happy story, because we are talking all the time of death and post-death things. The story of a young 17-year-old girl, Shreya. You can all have a look at her in any YouTube channel also. She was studying first year in a college, and her college bus fell into had an accident and fell down a steep slope, and she had her hands amputated. So when she then started going to a college of BA, Ferguson College in Pune, to do her BA. So she was not able to continue with her education as an engineer. After 1 or 2 years of different types of therapies and artificial limbs and all, she was fortunate to receive the forearms of a person who had passed away. So she's the first lady who has got a man's arm. And she's done so well with the life that she has got, that Shreya is doing everything possible to have a good life. And she just passed out of IIM Kolkata and started working in Pune. And she's a great ambassador of the cause. She's always agrees to, speak and send her videos and everything, so that people get motivated that the gift she got, everybody also should have a chance to get. That's what we are now having more than 20 patients who have had hand transplant done in India. Her transplant was done in Amrita Hospital by Dr. Iyer, Subramanian Iyer. And it is amazing. I have met her in person. A very jovial, nice person she is, and always full of life. And I'm glad that she's, doing well in her life after her transplant. But little remembrance for all the donors. These are the donors that have been counseled by Mohan Foundation's counselors. All these you can see are at different age groups, right from pediatric to senior. So there's no age bar. What the doctors see at the time of brain death is whether the organs are, good enough to give life, 15, 20 years of life to a patient. That's all they see after brain death is done, So age is no bar. 80 years old person has given 2 kidneys. So, there's no age bar to becoming a donor. You can pledge anytime you want. It is up to, somebody else to see how we pass away. These are some stories in the newspaper from Coimbatore about pediatric donors. These are actually our heroes. And the parents are our heroes because at such grief time, they have thought about somebody else and said yes to donation. But the process in Tamil Nadu is really smooth and good now. So all of us can make an impact, You may be having some contact somewhere. You please invite Mohan Foundation or inform us. We'll go to that place. This is a college which made a heart with all the students just to create awareness among its community. This is a person who made a poster for us, So simple things to major things like organizing a seminar, a webinar, anything you want. We would really love all of you to support this cause, not just by pledging for organ donation or cornea donation, but also create an impact in society about this. So now if you wish to register, how do you register to become an organ donor? So there are 2 ways to register. One is through the government website, that is NOTO website, N-O-T-T-O, NOTO. That is the national authority which sort of takes care of everything of organ donation in India. Go to the NOTO website and there is a pledge form there. Otherwise, you go to Mohan Foundation website and you can pledge over there also. If you are ever going to renew your driving license, now India has a clause in the driving license. Question number 7 is if you wish to be an organ donor or not. So if your grandchildren are going to become first-time drivers and getting their license, please ask them to consider to put it their thing in the driving license. Okay? This is not very much known to many people. And there should be some sort of concerted effort to have all RTOs put this up outside so that people who come to do the, driving license can at least think about becoming an organ donor. Other things you can do is organize such events. This is something that we love to do. And creativity is just unending amongst Indians, especially for Kolam and Rangoli. Creates a buzz. There are 4, 5 participants. Everybody's families come to know that there is something called organ donation and my child is participating. So it is very nice to have such things, for organ donation. We also have something called as a silent exhibition called Life Before Ashes. These are sculptures made from actual ash collected from Varanasi and mud. And just shows that what could have been real life has now become ash. It's a very hard-hitting exhibition. It's a silent exhibition, and if you have somewhere where you have an office and where you have space, we could keep up this exhibition for a week or so, and people can just have a look at it and just understand it, we don't need to speak, we don't need to talk, people just need to understand it. There is something called organ donation. You can recognize our Ripon building. On 3rd of this month, which was our National Organ Donation Day, we requested the commissioner, and he agreed to our request and made the Ripon building green. And just to show people that this is possible to be done. And on the next year, if we can have 5-6 iconic Chennai buildings as green, it would be worthwhile that entire Chennai will think about organ donation. We have more than 7 million population in Chennai, and it would be really good for at least 5 million to think about it at one go. Similarly, such greening of monuments have been happening in multiple places in India. Jaipur, Delhi, Qutub Minar, all these places were made. The Goa bridge, the main bridge on Mandavi River, that was also converted green. So somewhere the government is stepping in and supporting the awareness of organ donation by these initiatives. So this is where you can call us. We have a toll-free number. In case of a death at home, if you call this number, we will coordinate cornea donation at least, or skin donation or voluntary body donation. So kindly write down this number and keep it with you. And that is the end of my talk. There was a video that I had wanted to share, which I'll try and see if I can share it. Let me see, okay. Are you able to see this?
Yes, yes, yes.
Okay, let me see if the volume comes through. Can you hear it?
Yes. Not clear.
No, not.
No. Can't hear it?
Yeah, you can increase the volume.
I should increase the volume. Okay.
Sound is not there.
Okay, let me see. Otherwise, I'll send you the link. You can share it among
We'll
others.
explain what brain death is and how it is substantially different from coma.
Good, good.
Let us start by understanding anatomy. The brain consists of two parts, the cortex and the brainstem. The cortex is the larger part of the brain and the brainstem is the smaller. The brainstem is actually the top of the spinal cord. The cortex controls higher functioning activities such as reading, writing, and talking. If the cortex is seriously damaged, the person might enter coma and lose consciousness. But even in coma, a person might still feel pain or respond to stimuli. And sometimes a comatose patient might regain consciousness. Brain death is, however, different from coma. It's a term used to describe the whole brain dying, both the cortex and the brainstem. The brainstem is the central nervous system of the human body and the center of consciousness. If the brainstem dies, respiration would stop. Once the heart stops receiving oxygen, it too would die and stop beating, and all other organs will also die due to oxygen deprivation. How does brain death occur? If a person receives a serious blow to the head or has a major stroke, the brain might begin to swell. Since the skull is made of hard bone, it doesn't allow the brain to expand. Physicians can try medication or surgery to reduce the swelling, but if this does not succeed, the pressure on the brain can grow greater than the pressure of the beating heart. Once this happens, the heart can no longer force oxygenated blood into the brain. With no supply to the brain cells die due to the lack of oxygen. In fact, the cells don't just die. A process called lysis begins, where cells begin to liquefy. This liquefaction makes the brain death irreversible. Once the brainstem dies, the person stops breathing and the heart and the rest of the organs die due to oxygen deprivation. So how do we know the brainstem has died? Modern medicine has lots of ways to determine if the brainstem has died. One way is to check for the neurological activities that the brainstem controls. If the person is not conscious, cannot breathe, cannot swallow or cough, pupils do not respond to light, these are all signs the brainstem has died. In India, the Transplantation of Human Organs Act of 1994 specifies a series of tests that need to be performed by a team of 4 doctors before brain death is declared. The tests are performed twice with an interval of 6 hours. But how is it possible for the heart of a brain dead patient to keep beating? Where does the heart get oxygen from? The patient has been put on a ventilator to help him breathe. Afterwards, the brainstem dies. Even though the brainstem is dead and the lungs no longer function, the heart continues to beat because it is artificially being supplied oxygen from the ventilator. If the brainstem and the rest of the brain is dead, what is instructing the heart to beat? The heart is independent of the brain and is simply an automatic pump. As long as the heart gets oxygen from the ventilator, it will continue beating for a short period of time. After the onset of brain death, if the deceased is left on the ventilator, how long would the dead body's heart continue to beat? The heart can beat for a few more hours, sometimes even a few weeks. On an average, the heart would beat for 2 or 3 days and then die. Brainstem death is death. It is irreversible and systemic failure of all organs is inevitable. No one has ever woken up from brain death. If brain death means the patient has died, why does the body feel warm to the touch and looks like it's sleeping? The human being, the organism, is dead, but the organs, such as the heart, are kept alive for a few more days, giving the appearance of a sleeping person. An organ can be kept alive even outside the body by giving it oxygen. But the person is dead once the brain is dead. A brain dead patient is not a person suffering from brain death. He is dead. Once death has been established, the question facing the family in that situation is what to do. Should the family wait till their loved one's heart stops beating? Or should they express their wish to donate organs and save other people's lives? Emotionally, it's a difficult choice, and every family has to do what they feel is right.
Thank you. So we can be open for any discussion. I'll just have share one thing now. So this is, if you wish to pledge for eye donation, you can just scan this and pledge right now. You can just scan and keep it with you. And if you wish to pledge, you can pledge. Yeah. Okay, now I'm open for any questions you want, sir.
Sir, can I talk, sir?
Yeah, please.
Sir?
Please unmute and
Good
speak.
yes, sir. Good evening, ma'am.
Good
Very
evening,
wonderful
sir.
presentation. Very simple presentation, even for the common man, he can understand simply. You have simplified the whole topic, and it's very easy to understand for the common people. And also, thank you for remembering and recollecting and heaping compliments on me, man. It's all with
Yeah,
your
no
work and your foundation work. With Tamil Nadu tops organ donation.
Yeah,
Thank you, man. Thank you.
thank you so much.
Dr. Kanakasabai is a very great friend of us. We are connected
Okay.
with various organizations, he being the office bearer, etc. But then very active and very, not only active, very proactive in all these issues, and a very knowledgeable person. It is nice to see him. I was pleasantly surprised to see him being the earlier participant to join. as Dr. Kanakasabai has said, you have very comprehensively dealt with the subject, giving little scope for any questions. But still, we are all very smart people. So we will, however well explained, still some questions may or may not be there. But the most important thing you clarified is that there is no religious religion, whether any religion will prohibit or any such thing. That's a very great clarification you have given. After all, giving life, I don't think any religion will stop it from doing it. And second thing is the example of Shreya is very wonderful. This gives a lot of insight into how things can happen. See, generally, what happens is the moment you say organ donation, they feel that their organs have to be donated.
Yeah.
And why we should do it. That's not the case. One is, if they donate their organs, well and good. They is most welcome because you are giving a life. But then you spread this awareness and then make others know, as you said about the Shreya's case, uh, people may make use of this organ donation and technology and then give life to people. And that will be a very good that will be a very good thing to happen. And as you rightly said, the rough estimate of the donors required is kidney 2,50,000 in India, liver 80,000, heart 50,000, cornea 1 lakh. But these are all rough estimates. Sometimes the things don't get reported. So what you said is very good. We had a very wonderful presentation by you, and we will share this with all our known groups and people, so that over a period of time, this organ donation becomes a system of life. It becomes a way of life. Thank you, Hemalji, for your wonderful speech. We would love to have you with us on different aspects of what Mohan Foundation does in our forthcoming days. Thank you.
Sure.
And anyone would like to ask any question, please unmute and ask.
1 minute. I am Vanaja Krishnamurthy. Thank you. Within a short period, she accepted. I only called her, that is Emil. Emil is a very old friend that is for me. I am Vanajan speaking, sir. Badri sir, good evening.
Yeah, good evening, good evening. I'm watching
Good
you. I'm
evening,
watching
madam.
you.
Yes. I only called her and everything. Every other thing, something anybody wants a organ also, that is, I'll call her or other her assistant, Ganesh. Ganesh, 24 hours available. Their organization is so good and everything. We are conducted camp in Besanagar beach. That same thing we can also conduct. That is no organ donation. One day we'll do that. One walkathon, small walkathon with a school or with a college we can do, sir. That will be very much, because my office staff's brother in need of organ liver. He could not get it. So every MGM, he admitted in the MGM, they called, they 28 lakhs we are giving. You give, then we'll do that. But in the Stanley, that is medical dean, Mr. Dr. Magesh, I asked him, it's not a good mom, that too, without government approval, they cannot do. We should not do like that. That's what I got. That is really, I'm very afraid that people now so sick that we could not get the organ. We were 43
I
years.
would just like to tell everybody, please do your medical checkups.
Yes.
Keep yourself healthy. That is the
Yes.
first thing. Actually, I forgot to say that. But I think you're senior enough to know the value of having health, good health.
Yes. Really. Thank you, Hemal. That's
Thank
really
you, Vanaja.
Suddenly, they want to do. Suddenly, they remember your name only. Now I told Pranesh and we can ask her. Then it will be there. Now you are in Pondicherry. Tomorrow you are going, huh? It's okay. Okay. Thanks a lot. Thank you so much for that.
Thank you. Thank you so much.
Any questions? Please unmute and ask. Please feel free. Don't have any inhibition. And Dr. Hemal will give a forthright answer to you.
I think we should ask Dr. Kannakasabai to answer all questions.
So it becomes a double engine now.
Everybody is there in our group.
It becomes a double barrel gun.
No.
Any other questions? Anyhow, you see, it's all the initiative of our Vice President Vanaja Krishnamurthy. The moment we conceived the idea of this meeting, all done in quick succession within 24 hours or 36 hours. And credit goes to our Secretary Pranesan, who was
Yes.
after me for everything, for the preparation of the invitation, to arrange the Zoom meeting. Every minute he was following me. And one good thing we have is he's very free in the morning at 3 o'clock to 5 o'clock. Brahma Murtam, So we discussed a lot of things at that point of time, and we finalized it is all his efforts. And of course, Vanaja Krishnamurthy ji also had given a very quick solution as to how we have to go about it. If there are no other questions, I will request Secretary Pranay Senji to give the formal vote of thanks. Yes, there seems to be no questions. As I said in the beginning of this program, we'll be downloading the recorded version, convert into YouTube, and then circulate, so that people who missed to join this program will get empowered and be useful to the society. And as Dr. Himala said, the driving license part is very good, and that I think we should give more publicity in schools, colleges, etc., so that when they go for taking the driving licenses, they will. These are all multiple things you put together and then make the program a great success. And Government of India is doing a lot of efforts. In fact, the moment when it was decided to have that, I thought what the Government of India is doing. And as Dr. Hemalji has told, NOTTO does a very great job, and I could hear what our Honorable Health Minister, Dr. Nadda had. So thank you very much. And I request Pranay Senji to give the formal vote of thanks. Pranay Senji?
Yes.
Good evening to
Good
everybody.
evening to
I'm
I'm very
informed that when our president decided to
Pranay Senji, I think your other device you close. Otherwise, there will be
Okay.
disturbance.
Yes, please. When our president decided to celebrate organ donation day, immediately I contacted Madam, our Vice President, Madam Manaja Krishnamurthy. She has no hesitation to name the doctor. Immediately she gave the mobile number, all the details. So Dr. Hamal was very kind enough to contact me in WhatsApp and give all the details, so that in a short time we could arrange this meeting. We will be happy if Mohan Foundation gives these guidelines for all the organ donation in a printed way, or if it is sent to us in email or WhatsApp, we will print and distribute it to our members. And also, if any program is conducted at Mohan Foundation, we'll be happy to participate.
Yes.
We'll please invite us also. We'll come and attend some of our members. I also thank all the members who are taken much of time and attended the meeting. Thank you, everyone. Thank you.
Thank you. Thank you for thinking about organ donation.
People can also become members. The fee is only 2,500 rupees, and you get newsletters and updates and all those things. Only yesterday I became a member and I got an acknowledgement. It's nice.
Oh, you became a member. Oh, yes. I saw your email. Okay. Okay. Thank you so much for supporting.
Thank you very much. And we'll say bye and have a wonderful good night and have a wonderful week ahead. Thank you.
Thank
I
you.
will close.
Thank you, madam.
Thank you, thank you.
Thank you. Bye,
Thank
Vanaja.
you, Balchandar ji. Thank you, Balchandar.
Nice meeting you, sir.
Yeah. Hemal ji, shall I close?
Yeah, please. I should close it, I think so, because I become host.
Yes, you are only hosting.
Yeah. Correct. We have made you the host.
Okay, thank you.